Hello, hello. We are live with another episode of the Embracing Joy podcast. And I'm so excited about our topic today, which is where hormones, healing, and joy intersects with Dr. Makhija. Thanks for joining us, Doctor.
Thank you,
Um,
Dr. Maida.
yeah, I want to tell you more about her. Just to know that she has just a wealth of expertise and about this topic. So she is an endocrinologist and with advanced training in diabetes research, and she also has certifications in lifestyle medicine and plant-based nutrition. She founded a specialty practice that blends science with lifestyle tools such as nutrition, movement, and mindfulness to help patients take charge of their hormone health and prevent chronic disease. Outside of the clinic, she's passionate about whole person health through yoga, outdoor fitness, and community wellness programs such as laughter yoga and health screenings. Yeah, she's done such amazing things. So thanks for joining us today.
Thank you, Dr. Magda. Thank you for having me on your platform and your live audience. I'm excited to share more
Mhm.
fun stuff.
Yeah,
So I,
so
I really appreciate this. Yeah.
yeah, definitely. And people that are tuning in today, that are catching us live, make sure to leave a comment, leave questions. People that are catching the replay, also leave comments and questions so that we can get back to you as well, because this is such an interesting topic that we have with you all today. Okay, so let's dive into the questions. So, what led you to integrate lifestyle medicine into your work? Because I know
Uh,
you're an endocrinologist, but you've kind of advanced your practice.
Right, right. Yeah, thank you. Such an important question, and I keep reflecting on it often. And I think that was one of the reflections that led me to, found my own practice. But before I, share something more about lifestyle medicine, your audience and even, people who will be listening to the replay, you don't need a certification. You don't need like a diploma, which is fancy to practice lifestyle medicine. Movement is medicine, exercise is medicine, laughing is medicine. We hear about food is medicine, right? Even like self-care is medicine. So I feel like it should be a part of everyday care, everyday discussion between a patient physician or even a human to human, because that really helps us to bring about that vibrancy and living life with intention. So that's the core for lifestyle. So that's why it's called as lifestyle medicine. But to answer your question in a more professional manner, like why am I practicing this as a physician, is after completing endocrinology with a formal training in all these aspects, like you mentioned, diabetes, hormones, and metabolism. These are complex systems, and there's a constant crosstalk of these hormones going with organs, with cells, with pathways. There are crazy amount of feedback loops, which you have to correlate with patient symptoms, and really become like a detective. So yes, we understand the labs, we understand the physiology, you understand the anatomy of the human body, but it's the why. It's the why, which is several times hidden into a patient's lifestyle. It's hidden into their environment, their culture, their perception about disease, about stress, about, them having a symptom like simple as fatigue or some neck pain that they're always worried about cancer as their first concern. So that's where I really felt like as a physician, other than enjoyment of connecting these dots, we can't just be focusing on a specific field of science, which is more western medicine, to treat a disease or to cure a problem. But sometimes, I would say most often, patients need that pause. They need that time with the physician to go deeper. And sometimes they just need a lot of helping hand to take action into making into a meaningful change, in terms of prevention or even up leveling their health. And combining both these aspects for healing is what I really enjoy the most, because it's our behavioral changes as well as clinical biochemical for endocrinology, because we cannot live without labs. And then seeing the transformation of patients in terms of reduction of medications and improvement in their insulin resistance, the weight loss, feeling what they have felt the best, actually motivated me to incorporate it further into the community education that I've been doing with our people, other than the lifestyle and the bridging of science in my podcast, also, which
Mhm.
is Hormones and Hope. Um, the other aspect which people don't know much about me is part of this also comes from my upbringing. So I was born and raised in India, and that was a lot of Eastern way of thinking about medicine, about living, yoga, breath work, people going out for walks in the mornings and having a laughter session as a group, bringing about that social connection, eating seasonal plant forward meals. It was just a way of life which I didn't value, trust me, when I was growing up. But as you get into being a physician, practicing medicine, as you are advising your patients, you have to live that life. You have to walk what you talk. And that's where I decided to pursue like a formal board certification in lifestyle medicine, to meet like-minded physicians, to see their work, and also to get inspired.
Wow, that's such an amazing journey and how you were able to find that inspiration from your heritage as
Mhm.
your culture. And but then you also see how um, these lifestyle practices affect your patients here so that you
Mhm.
see the need for it more and that need to integrate that lifestyle medicine in addition to the endocrinology. Yeah, so that's such a great journey that you had. With that being said, let's break into our game, our warm-up game,
Hey,
which is
warm
yeah,
up.
yeah. Let's warm up a little bit. It's called we call convergence.
Uh-huh.
So we'll say the first word that comes to mind on the count of three. On the count of three. So I'll count to three, and we just say the first word that pictures in your brain. Okay, ready?
Sure. Yep.
Okay. And then we continue on by sequentially. You ready? Okay. So one, two, three.
Love.
Potato. For some reason, potato.
I said
Potato.
love. All right,
Potato and
potato
love.
and love
All
can
right.
in a
Something that's
movie theater.
so ready? We can we got it on the count of three. Something that connects those two. You ready?
Okay.
Okay. One, two, three.
Watching a movie.
Garden. I said garden.
You said God.
Garden? Yeah. Okay. So a garden and movie theater, something that connects those two. Okay.
Oh, that's how it goes. Okay.
Yeah, something that connects the two words. Ready? And it can be
Okay.
broad, nothing too specific like someone's name, but something broad. It could be a broad concept. It could be just something that comes to your head when you think of those words together. Okay. So we said potato and movie theater, right? No, garden and movie
Garden
theater.
and movie theater.
Garden and movie theater.
Oh my gosh, this is getting difficult. I don't know if this is a warm up. I think this is
This is a
intense.
warm up. It's a warm up game. Yeah, just to relax. Say the first thing that you think connects the two. Okay. One, two, three. Art. I say it's like art.
Yes, painting. That's what I was, yeah.
You were thinking
All
painting?
right. Yes, I have a
Oh,
painting right in
wow.
front of me, and I was like, okay, I can put that in the painting. So,
Yeah, that's amazing. So I think so that's pretty much very similar, but we could continue on. But I think if you're thinking art, painting, that's a good we could continue on to see if we get the exact same word, but but I think we're pretty much there with the painting art aspect. So yeah, do you want to continue on with it or is
I'll
that
leave that up to you. You know
okay?
your
Okay.
audience well.
I'll leave that because it's a fun warm-up game and we are in the art world if you're thinking painting and I was thinking art. So that's fun. So it's a fun game because so you play it and then sometimes we get to the exact same word. Sometimes you get to like a variation of the same word.
Uh-huh.
But it's just to warm up, have fun, laugh a little bit, and to get our juices flowing
Yeah, you're
So
making me more excited now.
yeah, yeah, you did great. So, but it's not about the other thing. It's not about doing great. It's about just having fun with it and just
Exactly.
saying what comes to mind. So you're not pressuring yourself. Okay, so what? How would you say lifestyle choices kind of influence long-term success and joy? What would you say about it?
Long-term success and joy.
Yeah, but like how does
Um,
lifestyle choices influence that?
Oh, yes, absolutely. We think that we have to do something to create a better life. But if we can simplify our living, and just think about our basic essentials. So I would say, my lifestyle, say, just giving an example of person A, which even could be me. What do I do as soon as I get up, right?
Hmm.
What do I think as soon as I'm up and rising up, and what am I doing? So
Mhm.
doing and thinking are two aspects that are much more in our control, and that could be a choice. So, for example, we constantly have this conversation with our patients as well as the community. The first thing when your eyes are open, are you thinking about your work? Are you thinking about what happened yesterday? Are you thinking about someone who yelled at you or criticized you, or your deadline which is to be met right now? Versus, have you got up and thought about, you know, two words of gratitude or something that you're grateful about? Or it's just thank you that I'm up and alive. I can live another day. So that's in our hand, that's in our control, that's a choice. So that's more often our thoughts, our mind, right? And the second aspect is
So
what do I do?
one moment, doctor. We're having a little bit of a technical difficulty, I think, on my end. I don't know if the audience is hearing that, but there's a little bit of a, it's like a, do you hear me?
I hear a lot of disturbance.
Static. Yeah, I hear a lot of static. Huh. So I'm not sure where that's coming from. Let's see. I don't know if because I could hear it when you were speaking.
But I hear it when you were speaking. That's okay.
You hear it when I'm speaking? Oh. Okay. I think it must be something with the StreamYard. And sometimes, let's see. Hmm. Let me just. How about now? Do you still hear it?
Pretty loud.
Oh, I think there's an issue with StreamYard because I got a message that they're having trouble streaming now to Facebook. But that's to Facebook. Um, hmm.
It's not their platform.
I think it's the platform StreamYard. Because because I fixed my phone settings. Mm, let's see. What should we do? Just get out and come back? Maybe get out and come back in.
Yeah, let's try it. I'll
Okay.
have to do. So log out.
Yeah, let's try to log out and come back in. All right. How about now?
Yeah, this is clear.
Clear. Okay. Let's see. So hopefully it would work for us. Um, we had, okay, so let's continue on with our question,
All
which was,
right.
um,
We were talking about
how
the
do yeah, how do lifestyle choices influence joy or long-term success? I know that's very, I guess it's a very deep question, but we can just tell me what you think overall.
yeah, yeah. Yeah, yeah. So, when we were talking about the first thing, like when we are up in the morning, right? Or up from your deep sleep, which would be so essential, is, what are the thoughts coming into my mind? And the second thing is, what actions am I doing the first few seconds of once I am literally living the first day of my life every day, right? So the part of gratitude, which is, yes, well studied in science, but even experienced by many of us when we actually practice it, no matter how skilled professionals we are, how busy our lives are, we have those 3 to 5 seconds to just be grateful to be living this day or to be breathing when we are up and about, right?
Mhm.
So that's a very essential routine that I find is definitely adding on to the meaning for a successful life. Because when we talk about wealth or we talk about success, it's not about being perfect. It's not about having so many X number of dollars on your paycheck or in the bank account. Yes, that makes your life way better in terms of how you're living, or
Mhm.
maybe the quality of life, but the peace of mind, the mental peace, is the actual wealth. And that will only happen and will only be in our control in terms of our choices. So that's the first choice I really, really practice and also advise whoever comes across me when we're having these discussions is the gratitude in the morning hours. And the second thing is, and what am I doing the first few minutes, right? Because when you probably have encountered this also, in this era we are just surrounded by screens or to do things or multitasking or trying to accomplish more as much as possible in that span of a day or a few hours or a few seconds even.
Mhm.
So just taking that pause again for another 5 seconds, so we spend 5 seconds in gratitude, and then 5 seconds in telling the phone, telling the screen that I will first take care of myself and then I will be with you, right? A couple of my patients actually practice it. They use the sticky note and they place it on their phone screen saying that I will get to you at 7:30 if they're up and about at 6:30 in the morning. So,
Mhm.
you won't see the notifications, you won't see anything that is displaying based on, what the screen is wanting it to. And you're not even involuntarily in automation, just trying to click on something thinking that, oh, I need to address it right away. So those reflexes are now in your control rather than they are just in automation, which will not lead to more of a successful living. So that's the second aspect, that I gift my own time to myself the first few either seconds or minutes in the morning. The second aspect that we fail to acknowledge and give it like a very, very high importance is activity, be it physical activity, exercise, doesn't have to be going to the gym, but that part is connected to longevity, to our brain health, to prevention of dementia, and all the chronic diseases that we talk about, but even mental health. And it's not that we need a mental health professional, but we need ourselves to pick these certain lifestyle habits, choices. And I put physical activity as the third important one after the gratitude, after making sure that you've given the thought to yourself that first comes me, my care,
Mhm.
and then the world, which is mostly the screen usually in today's 21st century. So once we've covered these important three things, it could be, 20 squats, it could be 10 push-ups, it could be, dancing on the, with whatever favorite music you have, but something in those morning hours to build that happy hormones. Also, we don't realize that all our hormones follow a circadian rhythm. And circadian rhythm meaning they follow a pattern of what other animals do when there is a wake up or a sleep and wake cycle, right?
Mhm.
So think about looking at your phone or think about just worrying about a meeting or a deadline. As soon as you're up, well, your cortisol is already going up, which is natural, it's physiological. But
Mhm.
you're magnifying the rise significantly by just starting your day with the worry, with the concern, with the anxiety that's building up for what's coming in the near future or near future hours for that day. So this is all connected to even how our bodies created the science of hormones. So my first three go-to prescriptions are usually these: the gratitude, the self-priority, and committing to yourself and vocalizing it. That these are the few seconds or minutes for me, and the physical activity. And then comes other pillars of lifestyle, which we could dive into if you wanted me to, give you the whole picture. But these are the first three things, first three habits, choices that would be essential before we even start thinking about, oh, what foods are good for me, or how can I sleep better now? Because you've identified how do I start my first day of my life every day to the best ability that I can possibly do. So,
Thank you for sharing those tips and how they're
do you
related
want me to
to.
cover the other?
Well, let's go into those just a little bit. I'm just going to comment on what you said first, and then we can
Sure.
go. Yeah, because I think it's important to have the small, like, I like how they are very small, practical chunks that anyone, especially someone who's listening, could start today. Is, and they're all something that doesn't take too much effort, right? So,
Mhm.
just having some thoughts of gratitude in the morning, not looking at your phone right away, but just at least taking that time to breathe, take care of yourself, take a shower, get dressed, whatever that is, and then do something physical. But it doesn't have to be going to the gym and working out for an hour, right? You mentioned like doing a dance or doing 10 push-ups as a start.
Mhm.
So something simple to help that hormonal
Mhm.
balance. Have you seen like when this is dysregulate? Like, so when people don't do these things, is that, or do you find that people with hormone imbalance improve a lot with just these method, or do they need much more intensive? Well, for example, like some people, because everybody's different, so some people have a much stronger hormonal imbalance than others. But have you seen like a lot of improvement in patients with just these tips, like these three
Mhm.
changes?
Sure. So just to clarify, we use this word very lightly, hormonal imbalance. One, we don't have this as a medical terminology, and hormones could. We have multiple hormones. There's a whole a bunch of these from the pituitary glands, which is in our brain, our powerhouse.
Hmm.
We have the thyroid, we have the adrenal glands, which release, three or four hormones. Then there comes the ovaries and testicles. So when we have symptoms, it doesn't mean that there is a specific imbalance which could be detected and tested on the blood work, and that would help us to understand. But when we are um, when we are just expressing that I'm stressed, or I'm
Hmm.
just worried about these things, it's natural for me as an endocrinologist, or you as a, as a family physician, that yes, this person is stressed, their cortisol level is also, going in this upward phase along with the adrenaline, because that's how we respond to stress with the help of our stress hormones. So those definitely will get better in terms of how we approach our lifestyle, right? But these are not pathological. I mean, this doesn't mean that there is a disease. It's just that it's affecting our well-being. It's affecting our mental health. It might lead to a disease for sure. If it's
Mhm.
chronically, that means long standing, weeks and months and years, it's disrupted. And that's definitely a pathway to insulin resistance, a higher risk factor for having prediabetes and type 2 diabetes, because now we are messing up the pathways by triggering our own cortisol production to be released every day at a higher amount just because how we perceive life. So, just to give you an example, like I have lots of females, high achievers, and they will get referred to me because their physician or their healthcare professional checked a morning fasting cortisol level, and it's
Mhm.
higher than what the ranges have been given by these labs. So they say they'll be somewhere close to 25 or 30, but it's physiological. It's still physiological for them. So then they
Mhm.
get referred to endocrinology consultation. Do I have an adrenal tumor? Do I
Mhm.
have Cushing's syndrome because my cortisol is skyrocketing based on the lab range?
Mhm.
But when you dive deeper, it's either their sleep is disrupted or there are challenges in life which is causing some distress, or they are probably up early at 4 o'clock and they have had meetings and then they're going to the lab at 7 o'clock in the morning.
Mhm.
Well, the cortisol has been higher and they need that higher cortisol to perform. But it's how they're perceiving that meeting, how they're perceiving that particular project. So, two individuals can perceive the same project, the same deadline differently, and still be efficient and productive. So, that's where I'm getting at. That hormonal balance can definitely be accomplished with the lifestyle changes that we talked about, and not keeping the diseases aside.
Mhm. Thank you. Yeah, thank you for that explanation because when I think hormone balance, I'm thinking of all the hormones, right? So,
Mhm.
but thinking of specifically not pathological, so not thinking about, disease states, but just increased stress and the detrimental effects that stress may
Mhm.
have, right? So, such as insulin resistance or anxiety or different issues that
Mhm.
stress may cause. Yeah, with that being said, so I know you gave us some tips as far as like starting the day and the hormonal rhythm, but for lifestyle, but what would you say are some practical tips for reclaiming joy when you're in a demanding career? Maybe give us three.
Sure, yeah. So demanding career, I think everyone who, you're physicians, yes, and then you're hosting your own podcast, and of course taking care of your patients. Uh, our choices create our demand. So it's not that we are making ourselves do something, but we should have the choice of saying no and yes to
Mhm,
those things. But this is such an impressive question, and you're asking me for three. So I can personally vouch for a few things. One is being single focused, which I've learned over time that how valuable it is. And when I say single focused, it means, to be very clear with what do I need in life, right? What do I prioritize the most? And for me, it is definitely that peace of mind. So even if I'm interacting with patients, if I'm, hosting an event, or even if it's an interview, when you start your day, or when I start my day, it's like, what's my single focus? So to maintain my peace of mind, no matter what the life challenges are. So
mhm,
each one of us can definitely have something that we can anchor or hold on to, that no matter what, I will not let this get disrupted. But it's also important to identify that peace of mind. Like, what is it for
mhm,
me, right? So the outside noise, the outside pressure that we are consistently bombarded with, to find that window where can I be with myself, be in the present moment, and that's single focused. Now, with single focus, an essential important component comes along with it, learning to say no, right? So say if I have 10 different projects, or 10 different events to attend, and they are not going to help me to, say, up level my patient care, or they're not going to help me serve as to what I'm there to serve them for, rather than just mingle around. If there is bitching going on, if there is gossiping going on, if there is just random, booze and fun, which is not fun for me going on, I should be able to say no to it, which I very proudly do so. And
Mhm.
that's helping you to remain single focused because you're diverting your energy, your actions, your thoughts, your company towards fulfilling that specific goal or need. And that's one of the best ways that I've learned not to get into this cycle of burnout, which occurs for physicians quite commonly when we're bombarded with patient care, with a lot of admin staff, with a lot of other commitments which they are bound to say yes to for everything. So learning to say no is the second one. And the third one I would say is getting help or delegation. So home chores is one. How to get your family involved in helping you out because you're not the only one who's supposed to do everything. At least acknowledging that fact that I cannot do everything myself. I am here as a human being. We are all here for each other. Man is a social animal. Your home chores, your responsibilities, if you are a physician, high professional or high profession where there are more demands, like you just mentioned that in your question, how can I assign few things? Like there are some people, there are some staff members, there are some colleagues, friends who could help me with that, and then we could build upon it. So delegation or sharing responsibilities, asking. That's the third important thing, which definitely helps to find time for yourself. Because if we don't have time for ourselves, I mean, the pathway to joy will not be found, right? Because unless and until I get to talk to myself, to be with myself, how am I going to identify what makes me happy?
Mhm.
So because you asked me three things, I would say those three things.
Those
One
3
is
things.
single focused. The second one would be, the third one would be delegation, and the second one would be, um, why am
Learning to
I
say
blanking
no,
out
you
on
said.
this?
Yeah, learning to say no is what you said? Yeah.
Off, Magda.
We are, yeah, we have a little bit of technical difficulties today. So, but we're still moving along. So thank you so much, Dr. Makhija. This has been just such a wonderful conversation. And I think we've started learning more about our lifestyle choices. We learned some practical tips that we can do as far as um, improving their stress by changing our morning routine. We also discussed a lot about um, how lifestyle choices can influence joy, and we also talked about some of the things that we can do as high achieving professionals to prioritize joy and to have more joy in our lives through 3 steps that you gave us. I know there's more, but you gave us the top 3. So, with that being
Yeah.
said, let's go ahead into our wrap up questions. And let me ask you, who is a model for
Mhm.
joy in your life and why? It could be someone you know personally, it could be someone who's a
Mm.
figure, famous figure, whoever that may be
Yeah,
for you.
yeah, yeah. It's my mom.
Mhm.
Yeah, she's an independent woman. She lives by herself in India, and she has this amazing aura. She's a retired principal, and how she engages in yoga, in mindfulness, teaching yoga. Having her students come over to her house and teaching them, math or English, whatever they need to, and then being out there for the community. She doesn't need us. She doesn't need the kids. All the kids are here in the states, and very physically active, and at the
Mhm.
same time honing on to the knowledge of medicine, how to take care of my health, how to be independent, how to stay mentally active, with holding on to the peace of mind. So definitely she's an idol for me.
Oh, that's great. And I'm sure she's taught you a lot in how to maintain that physical activity and lifestyle and mindset.
Mhm.
So if you were cooking a cake of joy, what would your top
Mm.
three ingredients be?
Cake of joy.
Mhm,
Love, definitely.
mhm,
Love, trust,
mhm.
and I would say a lot of hugs.
Nice. Nice. So
Does
this
that fill
is
the three
yeah,
components?
yeah, that's good. That's good. Everybody's cake is their own cake of joy, so, that's great. So, if our audience wanted to reach out to you to learn more about what you do and your practice, how can they find you? And, yeah,
Sure,
so please share
absolutely.
your contact or your website with us.
Yeah. Yeah, my website is unifiedendocrinecare.com. And if you had to follow me on Instagram, YouTube, Facebook, it's at Chhaya Makhija MD. And my podcast is called Hormones and Hope by Dr. Chhaya, where I interview a whole lot of physicians just like you do to bridge that gap of science and wellness.
Oh, that's great. I put your website in the chat, but I noticed there's a typo, so I'm gonna re-put it in the chat. Unified Endocrine
Endocrinecare.com.
Care.com. Unified Endocrine Care. Well, thank you so much. We have two people watching now. If you have any questions, please put them in the chat. This has been a great conversation with Dr. Makija, where we talked about hormones, healing, and joy. Um, and that is all that we have for today. So if you watch this episode, please watch the replay. Or if you're tuning in new, make sure you share this with a friend and take care. Have a great day, everyone.
Thank
Bye.
you. Take care.
Thank you.